real talk. Have you ever Googled your pet's symptoms?
Ooh.
And somehow ended up planning a funeral?
This is a good one. You could probably also put in here your own symptoms, because this is
Seriously,
more like
planning
what I
everybody's.
do.
I feel like Google really wants that. Like maybe Google's
Matt
like
had
bought into
lymphoma. It was a sore throat, guys.
It's
Hate
crazy.
to break versus bubble, but
I know. I feel like according to Google, every dog is dying, every cat has kidney failure, and every lump is cancer by the end of the day.
You know it.
You know? So anywho, I'm Amanda.
I'm Dr. Olson.
And we are
Feces and Laughter.
Okay, so today we're going to talk about why Dr. Google is the worst vet you've ever met. I feel like, especially over the past few years, pets have become more like family than ever. Mm-hmm. And it's, pet owners are just, they are shoulder deep in the interwebs.
Yeah. Well, that's it's so easy to find information now. It may be a little bit more challenging to know if that information is accurate.
I know. It's like one soft poop, and they run straight to the internet instead of reaching out to their veterinarian. And I get it. If it's 2 a.m., that it's easier. It's easier to pick up your phone and Google something. But we are not here to shame you. We get it. Pets are family. But if your search history has ever said, is my dog dying or just dramatic, congratulations, you are our people.
You're here, you made it to the right place.
Okay, so let's just talk about why Google is so unhinged, right?
Yeah.
I think just a couple of things to note. Google's going to probably prioritize worst case scenarios.
Things that make people click.
Like those rare dramatic outcomes that typically we're not sending them home with that same information.
Yeah.
A lot of symptoms heavily overlap.
Oh yeah. Yeah. And the idea behind a machine being able to identify something in a patient with no exam, not being able to be there, see the animal, like our pet's behavior, their normal routines, what they're doing outside of that one symptom is actually way more important a lot of times than that one symptom. Right. So just Googling that's going to give you a whole list of things that are probably really far from accurate.
Yeah, I feel like with the internet in general, everything, like the algorithms are heavily based on clicks.
Yeah.
Like they want you to click to the next thing, and it's not so much based on the context. So like you said, like they don't have baselines, they don't have pets' history, their age, medications, anything like that. So it's
Google hasn't even met them.
I know, and we have. So I'm just saying. But we know that owners are very much heavily invested in their pets' lives now, and so just felt like it's good to just kind of chat about
like when to Google, and maybe when Googling is not going to be the first step in this process, when we should maybe be the first step.
So I think one of the first big things that we hear is Googling about your pet's diarrhea.
Oh yeah.
And that it's an immediate right now emergency.
Yeah. And we did that episode on emergency.
Oh my God, I forgot all about that.
Yeah, maybe don't look it up. But we did one that was like really driven towards emergency vet or urgent care, general practice, that type of thing. And I think that's helpful to know. And diarrhea, it was probably a big one in that too. But I think we kind of lose sight of the fact that we've probably eaten at Taco Bell.
Yeah.
And we probably
everybody knows
evacuated it differently.
Yeah.
And we didn't call our doctor because that would be embarrassing. Like same thing, like our pets, they get into things outside, they get into things in the house. I know they're eating probably a steady diet, but if they get something off the table, or if they get something like they're chewing on something outside or eating grass or something like that, you may see that they have a change in their bowel habits. Sometimes stressors can lead to that. And so I think Googling that single episode with a dog that's bouncing around, happy, eating, drinking, all of that's vastly different than a dog that's like laying on its side oozing diarrhea. That was graphic.
I know, oozing diarrhea. That is one for the brain. That is a mental image right there.
You're all fucking welcome.
So yes, like one instance of loose stool is not equivalent to a crisis, but if you've got loose stool accompanied with, like you said,
oozing.
If there's
like
oozing,
lethargy, we refuse meals. There's significant amount of blood in the stool. It's gone on for a long time. So talking about frequency and actual length of time of this, the duration it's happening is going to be a lot more informative than just the single episode ones.
Yeah, your dog's bouncing off the walls, wagging their tail, eating, drinking, doing all the things, and they had that one random episode. Probably don't need to take to Google or beat our doors down.
Let's just want to see us. We're pretty cool.
Lie number 2.
Uh-oh.
Lethargy means imminent death.
Yeah, I think lethargy gets kind of tossed around a lot.
Yeah.
Like a dog that's tired because it went and you threw a ball for 2 hours this morning and it's now resting.
I'm lethargic all the time.
Or like a dog that is injured somehow, like maybe has an injury, is limping, and so they're not getting up. Arthritic dogs will sometimes not get up as often. So it is very different. Lethargic is and very ill is different than just maybe a change in behavior after some explanation for it. You know, if you've been traveling and that has been exhausting to your dog, they're not in their normal house, their routine has changed, and they get to their destination and they want to snooze, that is not lethargy. But if a pet is lethargic, not really wanting to interact with the family, not as responsive as normal, not wanting to eat and drink, like that can be something where, again, I don't know if Google would be my first choice because please actually Google lethargy and ask for a diagnosis and then send in all of them. I
kind of do want to know.
Yeah, and if there's not thousands, then I'm also more concerned because then it's not as all-encompassing as it should be. So, yeah, that is one that will get you in a lot of trouble Googling. It'll be very confusing to try to weed through what is accurate and what is not.
And I think the way you broke it down too, I think we tend to get the phone calls or the text messages from our clients that say like, oh, he's just not acting like himself.
Yeah.
Like clarification is huge when it comes to that. So like you said, like hiding from the family,
Yeah.
Define turning down treats, like clarification is going to.
Yeah. And we even have like NAR, not acting right, is actually an acronym that we use quite a bit
in vet med, all over the place.
But it is kind of an annoying one because it's so broad. And I have had owners that have come to me and said things like, I don't know, they're just a little off. And they have been absolutely correct. And we had done blood work or we have done exams and found that something was vastly off. So don't ignore that gut instinct, but definitely start to watch and try to define what that means. Is it that we are less active, that we truly are lethargic, that our appetite has changed, that we're stiff when we try to walk? Like try to get a little bit more information and clarity on what is actually going on instead of just not right.
And I feel like sometimes when I've said this to clients over the phone, in the back of my brain, I was just like, I really hope that they're not taking this as a cop out from me, trying to like push them off. But when I've had a client call and say, oh, he's not acting right, or he's not acting like himself, I think I need to come in. Me as somebody talking to a client, if I say like, you know your pet better than me, like it's not a cop out. Like you truly do.
Yeah, absolutely.
Like you see them every single day. You are with them all the time. And so, yeah, if you notice that change, like she said, go with your gut.
It reminds me of, I think we've talked about him on here before, but when we had our 14 or 15-year-old Pitty that started unplugging every outlet in the home, that was a change in behavior. That is a very strange behavior, but he never had done that before.
Right.
And so the owner felt silly telling us about it, and it turns out he did go to a neurologist, and they found a growing brain tumor. And so it's like those little things we do take seriously, although it may not be an emergency in that moment that they have some slight, not looking at my owner exactly right, start to put into context what that means.
Yeah, no, I like it. It is cool to see, like, especially the clients that are like, oh, like we have the one client who, Wembley's owner, who's just like, that poop don't look right.
Yeah. Yeah. And in patients that have those chronic conditions, like absolutely, like if they will know their pet and be like, well, we're on a prescription diet. We aren't allowed to do even play with a toy outside of this. And so there shouldn't be much change. And when there is, it was a much bigger deal for those that have those conditions. So it is hard to define, but for your normal healthy dog to have a single episode of abnormal stool or to act off for a moment in time and then go back and bouncing around, it's good to log it.
Yeah.
Like I love when owners have a notes
Journals.
app or journaling, and they come in and they're like, okay, well this has happened now once every 3 weeks, and then come to find out that is like the day after a visitor comes to the home and they're more tired the next day or something like that.
Yeah. Okay, so the next one kind of I feel like it's kind of in line with the diarrhea, but one episode of vomiting is like emergent. You got to go right now.
Yeah, and that will be tough too, because our ER, at least locally, I mean, I'm sure that they're having trouble even keeping up with the high demand when all the other hospitals in our town close and they're all by themselves trying to handle every emergency. If an animal was outside, ate some grass and vomited and is otherwise running around playing, ate a meal, held it down, all of these other things, it is hard to think, oh my gosh, I have to try to triage that and prioritize it when I have a list of critical patients that need me. And so it is worth monitoring your pet. They do get into funny things. We've had dogs vomit after eating the most ridiculous, but most of the time I would say it's from eating human food. And so
I don't know why my brain stopped at human. And I was just like, where's she going? Where's she going with this? And
here we go.
Like, eating humans.
Yeah, no, it's normally getting treats that they don't normally get, whether that's new treats from the store that are just higher in fat or changing what the normal food item is versus, getting that chicken off the table, getting that steak, bringing home food that from a restaurant that's been cooked in different oils and things and seasoned, is probably just going to upset their stomach. I would urge people not to do it, because that first episode of vomiting, that might not be a big deal. If it persists, just like the diarrhea, if it persists, if it becomes more severe, if there's blood in it, then it can truly become more of an emergency and even cause some really big problems like pancreatitis in your pet. So one episode is a good idea to watch and monitor. If it persists, then calling your veterinarian.
And I think just being aware of the difference in like vomiting versus, like, Franklin's a good example. I think he will go and gorge himself in the water bowl because he likes to sleep for hours at a time and then gets up and remembers like, oh, I'm thirsty, and then go and down his entire water bowl and then turn and cough and like
spit up
some water, but like not the same as vomiting.
And regurgitation and vomiting is hard for sometimes to be able to identify at home, especially if you didn't see it. So you don't know if they actively were retching and creating vomit, or if it like kind of fell out, both of which can have some medical concerns. I love the fact that there's now so many like puzzle feeders and slow type of like eating and drinking mechanisms to kind of help prevent those type, because my cats were terrible. I mean, I had to like, my food was on the floor in a line. It looked
I loved whenever you were out of town and you're just like, hey, can you take care of my cats while I'm gone? Can you just throw the food down the hallway?
I was like, I'm like, they make them find it, because if they sit there and they're like, oh, a bowl of food for me? Like a siphon. I was like, I've never fed them before. And so I love the different things to slow them a little bit. Even like putting a ball in a water bowl if they're like especially really thirsty after activity, is like make them kind of move that around and slow down. I have a floating disc water bowl now. It's supposed to help prevent all the water from filling all my floor, but I think my dog literally just fills his whole mouth and then dumps it.
Well, your dog likes to put his giant ass Kong in his water bowl.
I know.
Which like pushes the thing down.
Yes, I know. I think he's like, if I'm not in sight of this, somebody might take it. Someone like,
I know.
Like there's another animal to steal it.
I love when I see him do that. And like he drops it in the water bowl, drinks around it, and then picks it up and dumps all the water out of it onto the floor.
I know. Yeah, I know. It's really fun.
Quite amusing.
Yes. There are now washable like dog potty pads, which come in like cute colors.
That's
they
cool.
look like little rugs and
to
stuff.
put under like your water bowls and things.
Yeah.
That's
yeah, like I
nifty.
don't train him, my 85-pound dog, to piss and shit in my house, so it's not used for what I guess they could be used for, but for around the water bowl, essential.
Yeah,
it's
no,
essential.
that sounds pretty cool. So the last big one that I want to touch on, because I feel like this is one that, especially as you get like more aging dogs where you start to see these more often, are masses.
Yeah.
So every single
all the lumps and bumps, yeah.
it's all cancer.
Yeah.
They're all malignant tumors, and we're gonna die tomorrow.
Yeah, didn't you know? Yeah, that one I think is hard because we do get scared. You know, our pets mean a lot to us, and you know, I would be lying if I didn't say if I felt a lump, I'm like, oh shit, get this off of them. And so it is though important to know that there are some conditions that are benign, some lumps that, I mean, even from inflammation. So we have had bug bites that have created some temporary lumps, vaccine type of reactions that are temporary and go away. And then all the way down to like embedded ticks and fatty tumors and histiocytomas, which are the like stereotypical, if you don't get to the vet in time, it's going to go away. You'll be looking for it here. And then, of course, there are malignancies. Yeah. So if it persists, if it worsens, if it's growing, if your vet hasn't seen that one, it's really good to just bring up at every visit what are new lumps and bumps, measure those lumps and bumps, and then
I love
document
how
them.
Google's palpating them and like...
Yeah. Didn't you know? My favorite is when the TikTok trend, oh my God, I'm going off
No, tell me. I know. I don't know what you're talking about.
When the like vet hospitals, you know, and owners like send in a picture and they're like, hey, is this big deal? And it's like this random lump on the side of their dog.
And the doctor's like using the needle
and they do all the diagnostic tests, so
it.
they're like feeling the paper. It's like a flat piece of paper, and they're like feeling it, and then they're taking a needle and stabbing the paper to get a diagnosis, because these are things that we really do need to do. We have to feel if it's deeply adhered to underlying tissue, or if it's something that's freely movable. Is it in the skin, like an actual dermal mass? Is it a subcutaneous mass? Is it something deeper than that? Does it seem to have any irritation of the skin on top of it? Is it hairless? Is it firm? Is it soft? Like there's so much that goes into it. And then there's nothing that can replace diagnostics. So taking a needle type of biopsy, like the first least invasive step, it actually can give us a lot of information. I won't say it answers all of our questions. Sometimes we can't, because it's only the cells that can fit into a tiny needle that we're identifying, but we're using the microscope. We can send that out to pathologists for more information, and it can help us plan for any sort of removal. Does this look benign and we just monitor it for now? Does this seem benign but it's in a location or it's a size that we should probably take it off now before it worsens? Or is this seem malignant? We need to get it off now. And what do our margins look like? How much tissue do we need to remove to make sure that we get this all and have the best chance of full removal of this cancer? So this little needle kind of tap would actually give us a ton of information, but it also is not an emergency. So if you see a lump or bump and the pet is not acting any differently, it's not painful, there's no discharge, then it is something that you can give us a call, get in with the next available appointment, and have us take a look at it.
You really like removing tumors.
Shut up. Shut up. I might never again. I think I'm legit traumatized.
I think you hit your quota for 2026.
If there's 2026, I'm done. If there is a quota for that, then one of our clients takes the cake and had me remove 20 masses the other day from her pet. So, you know,
but that was actually that was an interesting one, because as you were taking them off, I know like I was there for a lot on the first side of the dog, and then I left and I came back and you had one particular mass sitting off to the side.
Yeah. And
as you were taking them all off, they all looked
very
the same.
Similar.
They were all showing up the same, and then that one had a different.
So and I think the difference too is that with this particular case and the condition that this pet has, I think it looks very different when one's rupture.
Yeah.
And so we had one that ruptured and become infected in an area on this dog, and all the tissue was very irritated. So it appeared vastly different than the rest of them, which I think was a body response. So yes, it can be. And this was a really weird case of, I think, like, yes, it was just odd.
So many.
But yeah, I did think that this is not usually the case that we remove that many at one time. I will say that.
Mass removals, check, done for 2026.
Wild.
Okay, so kind of shifting gears a little bit. I think just talking about why, like, as we move into the new year, Googling is definitely something that we want to kind of stay away from. I feel like pet parents nowadays are leaning more towards, like, we've got the social media, we've got TikTok and everything, we've got pet influencers, and there's so many digital products for pets now. And so we've got smart collars.
Yes.
We've that, like, and health trackers. We have these
cat
smart litter
that
boxes.
tells us
Oh,
things.
the cat litter too.
Yes, yeah.
All of these things we've got all of these new supplements coming out. We've got different wellness products.
Sleep trackers and all the stuff for pets. It's really cool. Like, I think this is freaking amazing.
Yeah.
And just realizing it's not replacing
That's what I was going to say. Like, all of that data going into the internet, because I think all of it's usually fed into, like, a Wi-Fi, like an internet-based app. Just
and
because
probably utilizing a lot of AI right now, which is very popular. And so it's hard. That is data. And data entry is looking at something as, like, a very finite, like, this is a defined number or something, but it does not take account your pet at all.
Right.
It doesn't take in account your pet's metabolism, your pet's activity level, how your pet's acting outside of this, what it looks like, how does its heart sound, what are its lungs sound like, what, like, all of these things that it's ignoring actually are a major part in the puzzle that is your pet. That would be similar to us being able to just stick things into a processing and think we know our body. And it's hard if it was that simple, and maybe in the future it will be, but if it was, then we'd all be perfectly healthy and there would be no disease, and we'd find things the minute it crept up. But it is difficult. I think that they're amazing tools.
Oh, yeah, absolutely.
I think they're awesome. And I think we can utilize the data from them when we're doing our exam. So it's not, I'm not discouraging any use of any of these products, but just making sure that we use them with our eyes wide open, that this is something that is a tool and not a diagnosis.
I think the cool thing is that it's telling you what is happening. It's not telling you why it's happening, though. So, like, these cat litters that tell you that your pH balance is off in the urine. It doesn't tell you why.
Doesn't tell you why, And I think what's interesting about those is that, so we follow that with diagnostic tests, right? So we can take that urine sample and tell, is the pH, has it changed? Is there any infection? What else is going on there? And there have been times where it was not correct, and that's okay. I mean, they clearly state that on the litter. There's other things that might be a factor. What else is in the room, or how long has that bag been open? What else has contacted it? And so it's not expected to be right all the time, and that's the cool thing, is the owners noticed a change. They brought the urine in, and we could confirm whether there was something going on in the urine or that it's okay, and just keep letting us know. I really love the litter robots that tell them how often they're in the litter and if they're actively producing urine, because we have some of our patients that are chronically urethral obstructed cats, so blocked cats, that they know that something's going on way before. Like, when you're at work, you don't know that your cat has been in the litter box 17 times, and so it has been awesome as, like, a first step, like, hey, I know something's brewing, and sometimes we can help them and get them through that flare up before it gets to the point of being life-threatening blockage.
No, I think the technology that's coming out nowadays it's amazing for monitoring trends and just, like, overall things with pets, but I think there's a very dangerous line of unintentional anxiety for pet owners when they are just, like, taking that information and trying to self-diagnose without consulting with their veterinarian.
I agree.
But I mean, we even had, or if, like, you've got the litter boxes, I was thinking about, if you've got a cat that just hates coming to the vet, we know that it's overweight, we're monitoring things, like, we have litter boxes that weigh them every time they get in and out. We had a client that updated us with the weights.
And it is something, again, like, when you clean that out and you move that litter box, we had one that was panicking because it looked like her cat had lost, like, 5 pounds. physically doing fine, doing great. And when they put it back down, it was there was something underneath one of the sides of that litter box. And so that change caused it. And so it was something that was like, again, it's a tool. It's not an end all be all. And so we knew that from the look of the cat and from our scales that everything was okay, but then kind of troubleshooting, why might this not be working? Because it is not foolproof.
Yeah, no, absolutely. So when we're talking about Googling and obviously Google's not the enemy, right? Like there is a lot of really good information out there. There are times when Googling is okay. So I guess, and you kind of give me your feedback. Let's say you prescribe a new medication and we've sent it home with the pet, and maybe the client gets them started on and they want to know what type of side effects they can expect. Is that something that you would?
Yeah, and I think using the term Google is can be misleading too, because we're like actually thinking like using google.com, but to us I think we're kind of referring to all of the internet as this. And so there are really cool veterinary specific ones. And so as the veterinary team that prescribe medications, we have a lot of information at our disposal to email to you if you want a lot, if what we verbalize for side effects is not enough and you want to read more, then we have the inserts from these products that you can get to. You can go to their actual websites and get like true like the actual packaging for these products and review it. And so starting somewhere like that's a little bit more reliable is helpful, and not like anecdotal stories. Like you don't want to like just look at like what one owner says. And there's also let's see, like veterinary partners. No, what is the now I can't remember.
You're
the
talking
spin
about the owner
off
one.
of Vin.
It is veterinary. I think it is veterinarianpartners.com,
and that is very, very well done. That is written by veterinarians. That is kind of cross-checked between
and
different
it's constantly updated as different studies come out and are confirmed.
Right, and so that I think is a great place to start. If your pet goes home on a medication and you're like, I want to make sure like I'm understanding that this is the medication, this is what I might see with it, then starting with something like that. And we, as veterinarians, we have all those resources for you. So never leave your vet office feeling like you're not sure. But if you get home and your pet starts experiencing a side effect that we didn't warn you about, then certainly that's a great place to start so you don't panic overnight or end up at the ER if it's something that might be normal. And then call your vet in the morning.
And I think that kind of rings true for like post-op, like not complications, but like expectations following a surgery or even understanding a diagnosis you were given. There are true veterinary sites or like reaching out to your veterinarian. But I think just talking to your veterinarian beforehand, so like that you've got this, that you want to go home and do your own research. And we have clients that ask for that all the time. Talk to your veterinary team and ask what sites you should be looking at, because they have a list of things that you can do.
And a lot of the veterinary schools, like the universities, have some great resources. So I know that a lot of my clients that have come in have already thought something was going on and printed out like from Cornell or just a really great resource and had proper information, and not something like, I think the problem we're going to start seeing with pet influencers is that this has now become a money-making type of situation. And so it is important to get the clicks. It's important to make these videos of products so that you can maybe get some more free product and make money off of that product when the person buys it from your link. And so when we see that, we may see that the results or the it might not be exactly what they're portraying, so it's not just about listening to somebody's advice if they're not in the veterinary field.
Well, I mean, that kind of takes me to the other side of things. It's when it's not appropriate to rely on internet-based information. So a lot of TikTok medical advice is not going to be factual, or not necessarily factual, because maybe it is to their pet,
right,
but comparing somebody else's pet to your own,
it might be, if that's a 1% chance that could have been a reaction to them versus 99% that it is successful in, or I'm kind of generalizing, but it's just, we don't want somebody's opinion to cloud our judgment on what our pet needs medically. We want to use the data that we have that is more concrete.
I think like forums and like Facebook groups.
Yes, yeah.
I always have to call you and have you talk me off a ledge. But like when I'm looking at different pet groups or reptile groups and I see all of this just wrong information and just bad advice being given, or like not all of them, because we have some really, really good breeders that we work with, but we have some breeders that send home certain information. Like we had a puppy come in recently that like just had really upset stomach, wasn't wanting to touch any of the food, and the owners were trying all these things, and they had been given a list with like 6 or 7 different things, including like baby food and like all this wet food, dry food, treats, so many different things that they were just throwing at this poor little puppy and couldn't figure out why she wasn't feeling well, and we were just like, you know what, let's slow down and reassess what we're doing here, and not, like I said, not knocking breeders at all, because we have some that are like they are on it, but just, you know, being aware of the information that you're being given from all different angles, and just knowing that your pet's different. I think allergies is another big one, that if you are following somebody, we're in North Carolina, right? If you're following some influencer that's in California and they're talking about their pet's allergies and what they've done environmentally, might be very different. And what they're doing might not relate to our landscape here.
Yeah, and it's and especially these conditions that are multifactorial. So like you have allergies, but the secondary infections and, you know, fungal disease and things like that can go along with it. It really needs to have some sort of input from a veterinarian.
Yeah, but I think the internet's a good tool, but it's not a diagnosis. So yeah. Anyhow,
absolutely.
I feel like that's a whole soapbox for a later day. So let's see where I want to go with this. Okay, so let's talk about some things that might be a big deal or might not be a big deal.
All right. I'm ready.
All right. I know that. I'm glad that you were so into this. Okay. So a dog ate grass.
Usually no big deal.
Cat hasn't eaten in 24 hours.
Probably big fucking deal.
Oh, yeah. I like it.
It can be none, but cats are weird. We don't want them to go, especially our chubby ones, very long. I don't want several days before you even reach out to. Sometimes you call, we give you some advice over the phone, and then at least we have it in our radar, like this pet may need to be seen emergently soon.
You're right. Dog limped once and then stopped.
No big deal. Also check its paw pads. It probably just stepped on something.
Your dog did that.
Little sand. Like
after like a whole day out playing in all these different parks.
Yeah. He had a little, I don't know what, burr.
I didn't get to see it up close,
yeah,
but it was prickly.
It was prickly, and it was in between his toes, and he didn't care. But I did see him limping earlier, and then thought, man, he's fine. And then
he
I was
got it into a comfortable position.
Yeah, it did. It got tucked in, and it was just sitting in all of his freaking hair, his Grinch feet.
Cat hiding and drooling.
Oh, big fucking deal.
A really big fucking deal. Your puppy sneezed twice.
No big deal.
Okay. Any other big fucking deals you would recommend?
Oh man, there's so many. Seizures, active hemorrhage,
hit by car.
Yeah. Vehicular trauma, hit by train, hit by golf cart, hit by
plane.
Oh my god. Yeah.
Oh man.
I feel like you'll know a big fucking deal when you see one.
There's quite a few out there, but there are some that are not. And I think just talking to your vet, I know our clients, I love that our clients are getting more used to this and utilizing this tool with us, but a lot of hospitals are utilizing two-way texting.
Yes. Oh my gosh.
And I love when our clients text and it's just
like, I know that this might not be a big deal, but my dog did this.
Is this a big fucking deal
my
or
dog
not
farted
a big fucking deal?
2 more times today than it did yesterday. Like, all right.
This fart smelled particularly bad. So I think finding those different outlets for connecting with your veterinarian and your vet team, and utilizing those things, because if you reach out and they're just like, oh, that's a big fucking deal, then set up an appointment and come in.
Absolutely.
If they tell you just keep monitoring, then they're probably not trying to push you off, but they're trying to save you.
And if they say go to a 24-hour emergency care facility, then you need you need to go. Like, trust your vet.
Yeah, absolutely. Okay, so I think what we've covered is that if the internet had its way, I think every pet in the world would be dead by dinner. But no, I think just knowing that your veterinary team, like, they love you, they care about your pets. We know that they're family. And we just don't love when the internet sends you into a spiral and has you just panicked for nothing.
Internet is a tool, not a diagnosis. That's what you're going to go home with.
The end.
Or I guess you are home. That's what you're going to stay home with.
Stay home with your tools. Hug your pets. We'll see you guys next time.
Bye.